3, 2, 1. Good morning and welcome to Pet Tips on Eagle Country 106.3, also heard and seen around the world on the World Wide Web. With us, Dr. Joel Saylor of Town and Country Veterinary Clinic.
Good morning. Yeah, we are posting these for better, for worse on our YouTube channel.
I'm telling you. And in between.
And in between, they show up on the Facebook too. So
there's the good, the bad, the ugly.
I don't know about that one, but so if you feel like, I just have to see that, that one session, you can check us out on Facebook.
Sure.
So I want to talk about seizures today. All right. And so typically we have they break down in two categories. So simplistically, we have what we call petite mals and grand mals. Petite mals are going to be these minor little odd quirky behaviors, fly biting, stargazing. They just kind of zone out. I remember having a schnauzer when I was a kid that used to fly bite, and he'd sit there and go, and we thought it was funny. Then I realized once I got in vet school, the poor dog was having petite mal seizures. And so those, and they're not that problematic. They are very annoying. They're probably annoying for the dog, and those can be treated as well. And then you have the grand mal. And the grand mal seizure is the down, out, collapse, boom.
They're out.
Right. And the thing is, we run into this sometimes. People say, I don't think it was a seizure because he didn't shake. Not all dogs will go through the contractions.
Right.
Some will vocalize, some won't. Some will urinate and defecate, some won't. A lot of times if you have an epileptic, what I tell people, when you come home and you find urine and feces that look like they've been finger painting with, don't think that they were being bad, think that they might have had a seizure.
Right.
Okay. Most epileptics are going to declare themselves usually between 1 and 3 to 4 years of age.
So young.
Yeah, very young, and that's our typical presentation. And just because your dog has a seizure does not mean that your veterinarian is probably going to start immediately putting you on medication. Okay, the reason is that medication is preemptive. Okay, it prevents. It doesn't you treat. Oh, I had a seizure. I'll go ahead and put him back on the phenobarbital. It doesn't work like that. Okay, because otherwise it's not doing anything. So typically my scenario when I want to medicate is when they're having at least one seizure a month, okay, or they're clustering, okay, which means they go into seizure, they come back out, go right back in, come right back out, and so the reason of that is that really you can damage the organ system, or this other unique situation called status epilepticus, where they go into a hard seizure and they just stay in it, and that's an emergency. But basically if you have one little 2-minute seizure that lasts, that you see once every 6 months, that's not worth putting the animal on phenobarbital. But if they're having those once a month, those kind of things, it's more important. Now, also, too, the other key thing, if you have an epileptic dog, always have a watch with you, okay? Or if you don't have a watch, get access to it immediately when it happens.
Sure.
Because when they do, what seems like 5 to 10 minutes is really only about 2.
And so forever.
It makes it a whole lot more objective to do that. And also, too, keeping a log, a calendar when the seizures happen, because memories fade and you can start seeing patterns where they're getting closer together, or you can see patterns when, say, things are happening at the house. For instance, the yard gets sprayed. A lot of the insecticides can alter seizure threshold, okay? And that's not saying anything against the person spraying. It's just, it is what it is. So, and so if you see a pattern with that, then you decide, okay, well, maybe I will not let the dog out here for several days until we've watered real good, and you can alleviate these things. And that's where keeping a nice journal on the calendar is very helpful. So if you're suspicious you have a patient that has seizure, or you have a patient that is having seizures and you know they are, you definitely want to get them checked out. There's a lot that we can do for that.
Sounds good to me. And we'll be back right after this message.